All right, so good afternoon. This is Heather Rayleigh interviewing Cheyenne Somerville. And Cheyenne, if you wouldn't mind just telling us your name and what your role is at University of Maryland.
My name is Cheyenne Somerville, and I am the OB peer recovery coach at University of Maryland. Thank you, sir.
Thank you. And tell us a little bit about yourself.
I am 45. I'm a mother of 8. I'm newly married. I am a recovering addict. A lot of people don't like to use them terms, but I am a recovering addict
Thank you. And where did you grow up?
here in Baltimore City.
Okay. And so I know you mentioned you're somebody in recovery yourself,
Yes.
but what specifically led to you becoming a peer recovery coach?
So I've been clean for about 6 years now. I'm coming up on 6 years, July 18th, 2 days before my birthday. And I just wanted to stay connected. Of course, I was doing NA meetings and, staying connected with my mental health and things like that. But I wanted to stay connected, keep everything in front of me. If I see it, it'll remind me about my story, how I don't want to go back, and I'm able to help people where I didn't receive any of.
So in your mind, what does it mean to be a peer recovery coach?
In my mind, it is being a bridge to resources, being able to reassure patients that they're not alone. And yeah, it's scary, but it's doable.
And if you would talk a little bit about your pregnancy and parenting, how do you think that your substance use impacted your pregnancy and or parenting?
My son wasn't as healthy as he should have been. As soon as I delivered, he was taken from me. And following him, they came to my home and took the rest of the children. The kids did about 18 months in foster care before I got myself together and was able to start living a normal life. My life was just chaotic. It affects the children mentally. It causes separation anxiety. When all they know is you, and one day they just are being snatched away from you, it causes a lot of mental health issues. So, yeah, you think you're just doing it to yourself and that you're not affecting nobody else. When truth be told, those ones that depend on you and those your family members or friends that love you, they're going through something as well because they don't know how to help.
So tell us a little bit about your recovery journey, like what sort of led to you seeking recovery, and then what did you find worked for you?
My kids being taken away from me is what led to my recovery. A lot of people say you have to want it for yourself. You can't do it for nobody else. But if you have something that gets you into the door, then it'll become something that you want. Yeah, my kids was taken away from me. They were my motivation at first. But then I started to want it for myself. So
And you mentioned earlier that now it's escaping me. I lost it. It was something you mentioned earlier right before we were recording. and it'll come back to me. And then how do you feel that your recovery has impacted your parenting since you've been active in your recovery?
I set boundaries. My kids don't like the new. My kids don't like the new me, but it's always been me, except for now. I know how to set boundaries, and they can't run over the side of me. So it's a good thing, and then it's a bad thing. If my kids would tell you, they'll say, "It's getting bad. Yeah, we got our mother back. We love her. We wanted to stay this way." But my rules and my boundaries it gets on their nerves.
And what do you do currently to maintain your recovery?
I do NA meetings. I still do step work. I have a sponsor. We go to we have sponsor little get-togethers. One night it might be at my house. I'll cook dinner. We'll order takeout. We just do something as a group. Have a little fun. Talk about recovery. Talk over our problems. Things like that.
Okay.
And I work
Mhm.
with women that want help getting into recovery.
Mhm.
Let me say that.
And how do you feel that your personal experience has helped you connect with patients?
First of all, they can't tell me anything. They can't tell me anything. I've been there. I've done that. You can't just straight up lie to me. Um, when I introduce myself to them, I let them know I am in recovery. I have been there. I'll share a little bit of my story of how I was pregnant and how my kids got took and how I had to fight to get them back and things like that. So I'm able to make a connection with them right then and there. They feel like they can trust me.
That was
Oh,
actually my next question. Like, how do you build that trusting relationship?
I don't sugarcoat anything. I try to be as real as I possibly can with them. I'm not gonna lie to them. Well, you know what happened to get you to this point. Now let me help you figure out what you need to do to get past this point. I just try to be as truthful and honest as I can with them.
So I do want to talk a little bit. So thank you for telling us about you. Before we get into kind of about your role and working with the patients, is there anything else you could think of that you would like to share about yourself?
So I'm not just a peer recovery coach. I went and got my certification. I am a peer recovery specialist. I'm ready to get my certification for community health worker. I'm working on my 40 hours to get certified with that. Um, and I'm not stopping here. This is my life and I want to put anything and everything into it. So I'm thinking my next step is going to be addiction counselor. You know, I just know it just doesn't stop here. Being in recovery, your work just don't stop. You got to keep working on it day by day, minute by minute, second by second.
Yeah.
So I think me learning more about it will help myself and another person.
Congrats! I didn't know that you got you're working towards your CHW.
Yes.
That's awesome, and that really pairs well with your role being so community based and helping with resources.
Yes.
So it's great.
Yes.
So as far as this role at University of Maryland, so you are the first peer recovery coach for the University of Maryland that specializes in working with pregnant and postpartum women.
Yes.
We call this Project Heart, helping expectant mothers achieve recovery together,
Yes.
right? Are you able to tell us a little bit about, you were here when it was a new program on the unit. Right. Anything that you can think of back to when this very first started? Any thoughts or feelings from staff? Was there confusion? Was everybody really excited because they knew that this was needed? What was kind of the feedback?
So a lot of people were excited, but they were kind of fearful that it wouldn't work. Because before me, someone else was in the position, but I suppose I don't know. I guess it wasn't for her. That's the best way I could put it. And then I came in and I was just running with it. So everybody know me now. I keep myself available to everybody. I meet with the doctors, I meet with the nurses, I meet with the social workers, and we put our heads together. What's the best approach to helping the patient? Each person is different. Everybody has different burdens. So we come together as a team and we figure some things out.
Great. And how are you made aware when there's a patient to be seen or referred to you?
The hospital, labor and delivery, mother baby unit would refer them to me, and in Epic, it'll land in my basket. Once they refer to me, I'll go in my basket, I'll check, I'll make contact. Or Amy, she will screen out who I'm supposed to get and who I'm not supposed to
And
get.
who's Amy?
Amy is the social worker
Okay.
for OBGYN.
Okay.
So she pre-screens stuff. So every once in a while I'll get a marijuana case, but it's not like the fentanyl cases or the cocaine or heroin or anything like that. For a patient who hasn't used, but because they received the epidural, they could come back positive. So she makes sure it's not from the procedure and that you.
Yeah.
Yes.
So it's a combination of screening,
Yes.
questionnaires, but also urine toxicology screens, right?
Yes.
Okay. And
the 4 Ps.
Yep.
So that's another way I get alerted that there might be a new patient being referred to.
okay, and that's completed when they're a hospital patient or an outpatient?
Yes.
Okay. And how many outpatient practices do you work with to support?
You talking about as far as treatment centers?
No, I'm sorry. No. So patients. So patients might be referred to you from how many different outpatient OBGYN practices?
Okay, so only University of Maryland. So it's the women's clinic on Penn Street. It's Redwood, it's Lombard, the clinic on Lombard, then labor and delivery and the mother baby unit.
Got it. Okay. And how do you feel that your role is important to pregnant people and then also parents with children?
So we don't wake up and say, we're going to get high and forget about the baby, and people judge a lot. They judge a lot. So that right there scares a mom finding out that she's pregnant and she's already been in active addiction. She don't know how to quit. She don't know where to go to quit. She don't know about the programs here at university or other places, because I refer out besides oats and things like that. Chrysalis House, Recovery Network, Power Recovery, you know, it's a couple of places. I wish it was more women and children treatment facilities, but I can only work with what I can. Yeah, it's being prejudged, is the fear of CPS being involved, is a lot of things. Is I don't know. I didn't have that chance to be scared. they my baby was took.
Yeah, that's what I was gonna ask you before. You had mentioned that you were telling me that you did not have that somebody there. You didn't have a peer
Right,
recovery
I
coach.
didn't.
Are you able to talk a little bit about that?
Yes. So I have 8 children, my children that I birthed. Have 8 children. My last child, I was already in addiction. So when I gave birth to him, they took him from the hospital. They came back, they took him at the hospital. They came back and took my other children. Um, my kids was in foster care for 18 months. Um, it was just a struggle. Like, I didn't have no family, my family didn't step up to grab my children. They was just put in the system. Like, and I was scared, like, what am I going to do? They didn't ask to be born. How am I going to fix this? And I had to fix myself first. So I called Chrysalis House. I got involved with FRP, Family Recovery Program. I set it up to where I would be accountable. If I had something over my head, I know I wouldn't do it. So I had to leave UAs once a week. I had to meet the judge once a week. I set stipulations for myself because if I'm not held accountable, don't expect me to do it.
Yeah.
And a lot of people think like that. If it's nothing over their head, they gonna do what they want,
Yeah.
right? So I was scared. I was alone. My children's father was in jail. It was me. It was me. And I had to fight for my kids. Be my lifeline.
Yeah.
Yes.
So how do you feel that your support of patients is different than the other providers in the hospital, like doctors and nurses and social workers? How is your role different?
Because I'm the more relatable one. I've been through what they're going through. I have felt most of the things that they're feeling, the fear, anxiety. Um, so I'm relatable. I'm more on their level than not.
Mhm.
So that's where I think they could lie to the doctors. If they're not drawing blood or testing yours, they can say what they want to say. You know, um, it's not that easy to lie to me. I don't have to take blood and I don't have to test your urine. I've been there
Yeah.
and I know. So, yeah, scared of taking the Suboxones or the methadone and stuff like that. It's better for you to take that than keep buying what we thought was drugs in the street and you get the wrong batch of something and it's over. I mean, that's how I put it to them. Are you going to trust the doctors, the scientists that developed this medication, people that went to school? Or are you going to trust the street chemists that don't know what they're doing, that's guessing at stuff and selling it to you? What's more safer? If you put it to someone like that, they'd be like, yeah, well, you got a point. And it makes them start to think.
So what kind of substance use are you seeing most frequently here in Baltimore City?
Mostly is fentanyl. They thinking they getting heroin, but it's fentanyl. Heroin is not even coming up in the tax screen. It's coming up straight fentanyl. Every once in a while, you'll see morphine and fentanyl, but heroin and fentanyl, no.
And you mentioned,
Oh, and Percocets.
so opioids in
Yes.
general. And you mentioned like Suboxone treatment. So living in Baltimore City, are you able to tell us about the resources that are available for opiate treatment?
So, our women's clinic here on Penn Street, they will prescribe Suboxone, Subzol, Dr. Mark does it. And I'm right here in Oaks, so they take pregnant women. So I'll refer some here. A lot of places will treat pregnant women with addiction.
Mhm.
Because like I said, that's the safest route.
So you're finding a lot of available places to send women who are pregnant for outpatient treatment, but it sounded like the struggle was
Inpatient treatment.
inpatient for women and
Yes.
children.
Yes.
So patients with substance use disorder, you mentioned earlier, face a lot of stigma and judgment that can impact if they want to seek treatment or recovery support. How do you typically address stigma or shame that either you and or your patients might face in the healthcare setting?
I explain it's a disease. That's one thing you gotta keep up front. And you can't only treat the addiction. You have to treat everything else. What if she had trauma? She need counseling for loss and grief. Any mental health issues, depression, anxiety, PTSD, whatever. You have to treat everything. You can't just focus on one thing. They go hand in hand. If I hear somebody saying something disrespectful or trying to lowball somebody, then I'll just pull them to the side and be like, you're wrong and you need to educate yourself a little more. And that's the best way I could do it. I don't know.
Do you have any examples that you could think of a time when either you faced that kind of stigma and how you addressed it, or a patient did and you sort of advocated for them on their behalf?
Well, since I've been working here, nothing like that, not to my knowledge, has happened. As far as myself, when things was said to me out of the way, as far as my addiction and my pregnancy went, I would get angry, or I'd break down and cry, or I would just lash out. Do you think that I want to put my baby at home? Do you realize that my body hurt and ache when I don't do this? Instead of you talking about it, how about you help me with it? But like I said, nobody helped. I had to figure it out on my own.
I heard a speaker once, I was watching somebody talk about substance use treatment for pregnant women and the stigma that they face. And they said something to the effect of, we need to stop asking ourselves, why do pregnant women use drugs, and start reframing that to, how can we help women who use drugs who've gotten pregnant?
Right.
Looking at it differently, because I think a lot of people think, well, how can they keep using when they're pregnant? And it's really just like anything else.
Right.
If you have high blood pressure, diabetes, that doesn't just go away when you become pregnant.
Exactly.
Right? You have to treat it differently, similar to substance use.
Yes.
Can you think of any lessons that you've learned while working in this role?
That I can't say exactly what I want to say at all times.
Tell us about that. How come?
Sometimes I want want it more than they want it. I want everybody to be okay. And sometimes I just want to take somebody and shake them like, oh my God, what is it going to take? But I know I can't do that. And I know I have to find a different way. um, you help them set appointments. You find treatment facilities that's convenient for them and things like that. And they're just not right. They're just not ready.
And so if a patient is not ready for substance use treatment, how else might you offer your support?
Look, I nag people. I said, my stalking levels have gone up so much since I started working here. My kids and my husband pay the price, I swear. My stalking levels is up here. And I think not necessarily hound a person, but find different ways to bring it to them, you know, to make them look at it differently. I check on them. Either I call them twice a week or I'll call them once a week and I meet with them once a week. Those are the stipulations for you being in the program. And we have incentives, Walmart cards, Target cards. I provide transportation to and from clinics. You have to show some initiative. Just dangle stuff in front of them. Do this and I do. No. But I do sometimes, but you can only do it with certain people.
So, I mean, in addition to treatment though, what other resources or support might you offer?
I do treatment, housing. I help them attain their IDs, transportation, get them connected with mental health. Anything and everything. If you ask me for it and I could figure it out, I'm going to help you. Baby supplies,
Great.
things like that. I do my best to help. Because some people just don't have anybody. Help them get connected with TCA or SNAP. Anything. I will clear out a couple of hours and we will sit at this computer and I will help them fill out the application because some people are not computer literate. GED classes, computer classes. I have almost everything. I will find it for you.
And why do you feel like all of these other forms of support are so important to somebody, whether or not they're seeking recovery?
Holistic health. I learned it when I was in recovery. You know, you gotta be financially stable, mentally stable, physically stable. You have to be stable in all areas. You can't.
Like substance use is just one piece of that pie, right?
One piece. There's so many different areas. Like when I was in treatment, I had to do anger management. I was angry with everybody, but more so myself. Had to do trauma, grief and loss. When I was in recovery, my grandmother was dying. She was in hospice. But my thing was not only am I doing it for the kids, myself, but before my grandmother leave this earth, she's going to see her cha-cha back together, because that's what she called me. She raised me. That was the strongest woman I ever known. You know, I didn't know how to deal with my feelings, what I was going through. So I buried everything. And when I buried it, I acted out. Oh, I ran. I did something destructive to myself. You have to figure things out. You have to know. Talk to somebody. Like when I was in recovery, my therapist, my counselor there, I said, look, check this out. I have a lot of issues and I'm gonna be needing to see you at least once a week. Friday's okay with you? She was like, 2 o'clock. I said, that's my time. That's my slot every Friday. Don't skip out on me. And she didn't, and she helped me do a lot of things. It was a 6-month program. But I was so scared to go back home because my kids wasn't doing what I was trying to do. Not the older 3. They were supportive as I went in, but they was still doing their own thing. So I didn't know how to enter back into the home. So I stayed another 2 months. And then when I finally did go back home, I did another 2 months outpatient.
Great.
You know, I knew outpatient wasn't gonna work for me. I had my own house. I could have came, that wasn't gonna work for me. I needed to be away from them. I needed to learn some coping skills, how to set boundaries, how to talk about what I was feeling. So yeah, once you figure out you, oh my God, it worked. So I'm just trying to get them to this point. I know it's not going to happen overnight, but I want them to know it's somebody that understands and somebody that's willing to help.
Do you have?
Answered all the questions.
What's that?
I said I probably answered all the rest of your questions.
No, I appreciate. I mean, your honesty is. I really appreciate it. I know some of these might be hard to talk about, but I really appreciate it. What do you think has been most fulfilling to you in this role?
People learning how to advocate for themselves. Some of the women that I come across are so timid and not outspoken because they feel so ashamed of what they're going through. So when they find their voice and start saying, well, I need help with, and can you help me with, and this, that, and I just love it. I love it.
And they learn to stand up for themselves and ask for what they need.
Yes.
Based on your professional and personal experience, what other settings do you think might benefit from having a peer recovery coach or offering peer recovery coach support?
Other than the clinics and the treatment centers.
Yeah, like when you were, just think back to when you were pregnant or you had younger children, where were you going that if you saw a peer recovery coach, you might have thought, I wonder if this is somebody that can help me? I don't know, WIC offices or libraries.
So WIC office would be one. I found this program called Baltimore Healthy Start. I'm not quite sure if they're still around, but now that I'm thinking of them, I'm gonna search and see if they are. I think because they teach women about lactation, they do parenting classes and things like that. So, and pretty much they was community based. So I think a peer recovery coach in there might work.
I know some of our health departments in Maryland, though not all, but some have specific OB peer recovery coaches, or for postpartum moms is usually where we see that. One thing that I'll say that I've noticed is different about the role for Project Heart coaches is that usually in very few hospitals or healthcare settings is support offered prenatally. Usually nothing is done or offered until that baby's born
right.
and the baby's been substance exposed.
And with Project Heart, I get them as soon as they come in.
Yeah.
So I could get them through their whole pregnancy. I could get them when they deliver, and I get to work with them for some time. So
Yeah.
I built relationships.
Yeah. And you can also talk with them through the pregnancy and say, you know, because I know some moms are worried that, well, even if I don't want to go on a methadone or Suboxone, because even if I test positive at that time, you know, if I test positive for methadone, they're still going to take my baby, or there's
Right.
that fear, right? But
Mhm.
you can explain to them.
Right. And that's what I
Yeah.
did. That's what I did. I think the hardest thing for me was a baby died. And it just did something to me where I had to call my therapist and be like, look, this happened, this happened? And the mother was blaming herself. So she was spinning. And I had to grab hold of her, but I had to get hold of myself first because my emotions was like all up in it.
I've got to connect you with Brenda and Lakita. So Brenda's right here at Harbor. I mean, it's what, 10 minutes away, Harbor
Mhm.
Hospital. And Lakita's up at Franklin Square, but that's right up 95. And they are both originally from Baltimore City. They're both OB peer recovery coaches. But I think in your role, there are so few people that could really understand something like that. Of course, a therapist can help work through it, but nobody else has had that same experience where their patient's baby had died. You know, like they
Right.
can't really understand and empathize the same way that they could. So I'll make sure I connect you guys again. I thought I had done that. I'll make sure we do that.
Thank you.
Do you have an impactful story that you would like to share? Either maybe helping a mom get into treatment or having a mom contact you after several months, or anything you could think of without giving any patient names or specific information.
I have one patient, well, not just one. I have a patient that came to me when she was 5 months pregnant. She kept all of her appointments. She connected with Oaks. She completed Oaks. Got her a car, got her a house. Her first baby. She learned coping skills and doing mental health, and I think she my biggest. She calls me. She calls me like, I know I'm no longer your patient, but
So how long has it been?
our case with me has been closed for about 4 months now, and it doesn't matter. She'll still call me. Not a week go by that she don't call me and be like, I'm doing good. I just wanted to tell you, or this, that, and the other happened, and I'll be like, all right, let me check into some things. I'm gonna text you, but I'm not you. I got you. Just calm down, you know.
And have you received any positive feedback that you can think of, either from patients or from staff? I'm sure you have, but are there any that stand out,
I
that
had.
especially felt good?
It felt good that knowing that the fight for a permanent position for me was being fought. Like, they knew when the grant was going to run out before I did. You know, I knew it was coming up, but I didn't know. And they was talking to people and making sure I had everything that I needed before they even brought it to me, and then sent me an email like, look, I was discussing you to this person and that person, and we would like to offer you a permanent position because we would hate to lose you. Please stay. Please say that you're going to stay. And I was like, yeah, y'all got me a permanent position. I ain't going nowhere.
Yeah, those discussions have to start months in advance. So that, I mean, what that means is that you made your presence known and it was found to be valuable early on,
Yes.
right? Because it's only about 12-month grant period, right? I know this
Yes.
one I think was extended a little bit longer just because the funds weren't utilized, but I mean, they need to start that like 6 months out. And so they immediately clearly saw,
When I came in from first day, I was getting my resources together. I was, meeting with the doctors and the social workers, and I just didn't sit quiet. I'm not a quiet person. I'm not a quiet person, and I fought for everybody. I fought for the women that I work with, like I would fight for myself.
how long have you been in this position?
Since July 19th, the day before my birthday last year.
It's not even a year? I in my head, I had this 2 years.
July
It feels like so
19th
much
last
longer, I
year.
guess, that I was here doing training with you. It feels like far before that. Is there anything else, or let's stay with that question for a second. Any direct feedback ever from nurses or providers that you can think of? Anytime maybe, I don't know, a patient wouldn't talk to anybody else and they opened up to you and the nurses said, they
So
wouldn't talk to any of us.
one of the counselors that's in the office next door to me, she'll be like, thank you so much for everything that you do. I swear you are a big help to them. She says this to me all the time. You did more than I'm allowed to do, so I just want to thank you for going above and beyond for them. You do great work, and if you ever need a reference, I got you.
That's great. And anything else you could think of that you would like to share that will inform others about your role or make others aware of what peer recovery coaches do?
Peer recovery coaches aid women who suffer with substance use disorder. But it don't stop as far as recovery goes. We connect them to the necessary resources that we need. We do recovery and wellness to pinpoint barriers. We help with baby supplies. We educate. A peer recovery coach is a positive, not negative. We don't leave the patients feeling lonely and feeling like they have to figure everything out on their own. We don't do all the work, but we will assist them, to teach them to advocate for themselves. I think if peer recovery coaches was around when I needed them, my journey would have been a lot more smoother.
That's great. Anything else you could think of? Anything else you'd like to add? Any questions you have? Anything?
Did you see how nervous I was? My eyes rolled up in my head. I'm not.
Not to put you on the spot, but again, we can, if there's anything else you think of, we can start it again.